Hello, my name is Brylan Pullman, and I will be presenting to you today on major depressive disorder. So first, the purpose of this presentation is to educate others on what major depressive disorder is, the symptoms, diagnosis, misconceptions, and general feelings and involvement of what major depressive disorder is. What is depression? Most people use this term very loosely and don't really know exactly what it is. We do define depressive disorders as, quote, a group of disorders in which depression is the main feature. A common misconception with depression is that it is just feeling sad, and even though people can have feelings of sadness over and over again, like they believe it is a one-time kind of thing, that the event is isolated, but in reality, depression is way more than that, and people with depression have a range of emotions, and the feeling of being depressed is the overlying and most common pattern that is involved in their lives. So, on to the diagnosis and symptoms. You need to talk to a doctor to actually confirm these, but typically feeling depressed for 2 or more weeks shows signs of major depressive disorder, and major depressive disorder is considered to occur in episodes, which means that it'll happen for some people rather suddenly, but it will go on for a long period of time, and that period of time varies per person. You can also be subjected to physical exams, lab tests, psychiatric evaluations, and referencing the DSM-5 to confirm a diagnosis of major depressive disorder. We also know that 50 to 60% of people who have one episode of depression have a second, and that it is 70% likely that those people will have a third one, and 90% likely that they will also have a fourth one. And some symptoms that include that, we already talked about the overall daily depressed mood. Other symptoms include loss of desires for hobbies and normal activities. This is a very commonly recognized one for people with major depressive disorder and for the other people in their lives, and it is usually what people see most. Other ones include loss and gaining of weight, insomnia, inability to sit still, pacing, and even uncontrollable twitching, slower speech or movements, fatigue, feeling of guilt or worthlessness, and suicidal thoughts and ideations. Another aspect of major depressive disorder is comorbidity, which just means that 2 disorders can occur at the same time in the same person. So we know that 41% of people with obsessive compulsive disorder also have major depressive disorder, according to the DSM-5. We also know that people with anxiety are more likely to also have major depressive disorder. There are many treatments and therapies, but the most common ones I found in my research were psychotherapy, which includes seeing a psychiatrist or a therapist, a trained professional for the patient to regulate and work through their depression. Another one is hospitalization, and this is usually for people who need more care during their episodes or in general. A very common one of the most common ones, is medication, and that includes SSRIs, SNRIs, atypical and tricyclic antidepressants, and MAOIs. Some of the less used but still present treatments is electroconvulsive therapy. This is usually for people who can't take antidepressants due to health concerns, and for people who are at a high risk of suicidal ideation. Another one is transcranial magnetic stimulation, and this is for people who have not responded to antidepressants in the past. Treatment effectiveness varies per person, and people with major depressive disorder should keep trying to find the right treatment for them with consultation of a medical professional. And it really does depend on the person, but the most common and most effective ones in most people are medications and therapy. So we already talked about the common misconception of what depression is, but another one is, and I quote from the book, "Although the episodes can last for months, a majority of people diagnosed with this condition recover within a year. However, a substantial number do not recover. Around 12% show serious signs of impairment associated with major depressive disorder after 5 years." So why this is a misconception is that a lot of people believe that once they feel better, or when they're out of a depressive state, or just into a more positive one, they don't feel like they need it anymore, and a lot of people fail to take care of themselves that way, and it's something that they should keep up with and keep in check with and maintain regularly, regardless of saying that they have been cured or not, or recovered or not. And these are my sources, and thank you so much for watching my presentation. I hope you guys have a good day. That's it.